sponsors. I appreciate y'all being here. Um, I am the coordinator for Auburn Cares. I also am working on my PhD in higher education, so I understand the graduate school struggle. I know that you are putting in a lot of work and a lot of long hours, so I appreciate you like making time out of your day to be here and learn a little bit more about what Auburn Cares does. When I talk about the services for my office, I'm going to put up a PowerPoint in a second and kind of work through that. But I want to remind you that like you as a student are eligible for all of these things. So when I'm talking about this could be things that could help you. But I also know that a lot of you have like GA positions or work with undergraduate students. And so you may also want to think about like, oh, how could I make sure that like the students I'm working with are aware of these resources and things like that. And then also just think about your friends, cohort members that are also in your program. If you feel like somebody that you know might benefit from these services, that could also be totally appropriate as well. So it just kind of, there are a lot of different options here. So just kind of encouraging you to think about that. Okay, let's see. I will open this up. Okay, can you all see that? I'm gonna try to do this way, but I have been told previously that when I share this, so like when I go to the next slide, did y'all see that change slides or no? Does it still just say Auburn Cares? Okay, I don't know why this does this. It's okay, that's very annoying. All right, so we're just gonna go back to this then because I can't ever get this to cooperate with me. So, okay, so in a nutshell, Auburn Cares provides support and resources to students in crisis. And typically when I say that, people kind of give me some kind of like, okay, sure, but like, what does that really mean? Which is totally fine. So some of the most common reasons we see students either be referred to our office, like maybe their advisor or a faculty member recommends that they connect with us, or says like, hey, can you reach out to this student? Or students can self-refer. I'll kind of go through that a little bit. But some of the main reasons we work with students are for like emotional distress or mental health issues. We also work with students who are having or who have had some type of like injury, accident, a serious illness, hospitalization. So anything above kind of like I scraped my knee. If you've like broken your leg and can't get around campus and need help with that, those are all things that we are able to help coordinate. We also work with students who are having financial related difficulties. So maybe they're like homeless or struggling to be able to buy groceries, or maybe, they've had some kind of like significant event happen and they're just really struggling with their finances for a period of time. We can help with those concerns too. And then we also see some family relationship difficulties. And so that could either be like someone who's recently maybe lost someone, so going through like the grief process, that can obviously be really difficult. Or maybe someone is just having a really hard time like setting appropriate boundaries with their parents now that they're in college. We see that a fair amount with undergraduate students and kind of learning how to like walk that line. You as graduate students probably have that down and are a little better equipped than our undergraduate students at that. So a couple quick things about us just to make sure that we're clear here is that we are considered a non-confidential resource in like HIPAA terms, which HIPAA is like your private protected medical information. So if you had a doctor's appointment today and I tried to call and say like, hey, how was Lexi's doctor's appointment? The doctor would say like, I can't give you that information and I can't even confirm or deny, that Lexi was even here today. Whereas my office is, we are not required to fall under HIPAA. We only follow FERPA law. So I'm not going to share your information with anybody. It doesn't mean that I, like post your information online or tell people about what we talk about. It just means that we are not protected under those same mandated like laws. We are mandated reporters. So if somebody reports some type of crime to us, like a sexual assault or stalking, we do have to report those things onto Title IX. Title IX is a confidential resource. And so if you do have some type of issue like that, that would be the person you would go and talk about if you are interested in a confidential office. We also do not provide counseling services. So if you're interested in specific counseling for mental health issues, that would be done through our student counseling and psychological services office, whereas our office can provide like outreach. So if you call me and say, like, hey, I'm really worried about my friend in my cohort, it sounds like, they've been telling me that they've been feeling really anxious about, their upcoming dissertation and how much work they have to get done. And I'm just really worried about them and want to make sure they're okay. Can you call them and check in with them and talk to them about, what resources would be appropriate to help them? Absolutely. That's something that I can do and do pretty regularly. So just want to be clear about some distinctions there. So like I kind of hinted at earlier, students can be referred to Auburn Cares in all kinds of ways. So oftentimes we have like faculty or advisors refer students. We also get a fair amount of parents that call, especially for our undergraduate students. And then we get some referrals through community members. So like if a student were involved in a car accident, the police would let us know so that we could follow up and make sure that they're okay. And then outreach. So just like right now, I'm doing this presentation, I'm letting y'all know about what Auburn Cares does, and then hopefully this will increase people knowing about our office and people using our office. We do also have an online reporting system that's pretty cool. So if you want to just fill that out and say, hey, can you reach out to this person? I think something might be going on. That is really great, and you're always welcome to do that. I'm going to quickly kind of work through some of what I call like our warning signs. Prior to being in this role, I was a mental health professional and worked as a counselor. So sometimes I can kind of pick up on little things that might be going on that are indicative of maybe something larger that a student hasn't quite figured out how to talk about. And so I'm going to kind of work through some of those with y'all because I don't anticipate that you are a mental health professional. And so sometimes what can just seem like weird behavior to you, maybe things that we want to know about. So just kind of let y'all know some of those, some things to look for, and maybe reasons to refer students to us or things to look for in your friends. Or also, like I said, I'll kind of work through some more of this to talk with y'all. If you feel like this sounds like you and you could use somebody to talk to, you're not quite sure where to start, you can always start with me. So academic signs. So if you are maybe an assistant in like a class or something like that for your graduate assistantship, this might be things that you would notice with students. So a decline in performance. So a student who typically has done really well in class and then suddenly they're not doing so well. An inability to cope with pressure. So somebody who just seems really overwhelmed by maybe their workload or assignments or things like that. Concerning communication. So that would look like someone maybe just sending like weird sporadic emails or emails that don't make sense, missing classes or assignments. Sometimes that just happens. But if somebody is continuously like not shown up for class for 3 weeks, something might be going on there and we may need to connect with them and make sure they're okay. Disorganized or erratic performance, that basically means that somebody would be like doing really well in class and then not doing well and then doing well again. Sometimes that can mean that maybe something else is going on outside of school. And then continual seeking of special provisions. What I mean by that is if you have a student who maybe misses class today, Wednesday, because they're sick, and then Friday they miss class because their dog's throwing up and they have to take them to the vet, and then they miss class on Monday because their car broke down and they can't get to campus, and then next Wednesday they miss class because their roommate is ill and they have to take their roommate to the hospital. Like either that student is having a terrible couple weeks, or maybe something else is going on that they haven't quite figured out how to talk about or how to ask for help with. Or sometimes students are just kind of afraid to ask for help, especially when you as a graduate student are kind of in this role of like positional authority. It can be hard for them to talk about that with you. So other things, I think these are a lot of times easier to see in students. I know right now, given the pandemic, if you're maybe interacting with students online, it may be harder to notice these things. But if you ever have time built in to just sort of check in with your students, that might be really helpful for them to just know that you're there and open and willing to help if possible. So some things that you might want to look for are just like disruptive behavior or changes in mood, any kind of like self-harming behavior. That's obviously something we would really want to assist with. Thoughts or threats of harming others. That's obviously another big one. Any kind of outbursts, and then also like changes in hygiene, sleep, eating habits. Those can all be indicative sometimes of like mental health issues. If you see a student who is just like really struggling to get out of bed or not taking care of themselves in the way that they typically would. And then this last one is like social and emotional concerns. So relationship issues, which I kind of talked about earlier, or someone experiencing loss, as well as depression, and then thoughts or threats of suicide. That obviously, those are big concerns, and we want to make sure that we get those students connected with any kind of support that they may need. So some of the things that my office then does once we're connected with students is a lot of what I do is truly just like reaching out to students, or if students reach out to me, it's just kind of saying like, tell me what's going on. How can I be helpful? How can I be there for you during this? Like, would it be helpful if I continue to call and check in? Sometimes people are just going through hard things, and it's nice to know that you have someone there to talk to and to listen. And sometimes I can provide, like, okay, it sounds like this is really the issue, and maybe you need to get connected with this office and then also with this program in the community. And that can be really helpful. So doing a lot of referring to resources that already exist. There are a lot of really great programs on our campus and within our local community. So just utilizing those sometimes can be really helpful. I also am happy to help work with students on kind of figuring out their own self-advocacy skills. So like asking for what they need and how to approach the correct people, how to have those conversations. That can be difficult. Then we do a lot of like talking with other faculty and staff as appropriate. Like I said, I am not just out here calling up random people to, tell them about what's going on with a student. But if, an advisor may be the more appropriate person to talk with a student, then I absolutely may involve that advisor and say like, hey, could you, have this conversation with them and make sure that they're aware of what they need to do. And then some other things that we do is we do host the annual memorial ceremony every year to honor students that have passed away within the past school year. We typically do that every spring. This year, we will likely be doing that virtually, but we still welcome anybody who would like to attend and honor any students. Then we also oversee the medical withdrawal process. And then we run the campus food pantry and Feed the Family Fund, and I'll talk about that a little bit more. So medical withdrawals are necessary when a student has some type of medical condition that interferes with their academic success. So as you can imagine, let's say, you broke your leg and you are in a program that requires you to like be in a lab and stand up all day, and you have to have, some type of like reparative surgery and then do physical therapy. Obviously, that would be really difficult for you to stay in those classes. So oftentimes the best thing to do is medically withdraw. We do also do these for mental health reasons. So if students are having issues with their mental health and seeing a doctor, then that is what goes on. So it does, like I said, require documentation from a medical professional. So a student has to get a letter from their doctor basically stating why this is necessary. Next thing I want to talk about more in depth is the campus food pantry. I know I've talked about this at previous graduate school programs, and I am always happy to share about the food pantry and to encourage more people to use the food pantry. So the food pantry is available to any student. So please hear me when I say that. I literally mean any student. If you are enrolled at Auburn, if you are taking 1 credit hour, you are eligible to use the food pantry, and then you can use the food pantry every week. All you have to do is just email our office and get connected, and then typically I or one of my interns will meet with you, and we'll just go over some quick paperwork, kind of explain how the campus food pantry works, and then you will be all set up and ready to go. So it's not like a really intensive process. I don't need to know how much money you make or how much money you don't make, anything like that. Truly all that is required of you is that you are enrolled in classes. If you are a part of an organization that would like to donate to the campus food pantry, we also are always happy to take donations. So please contact me if you are interested in doing that, and I'd be happy to talk with you about what items are most needed right now. We also run a program called Feed the Family Fund, which is specifically for students that are experiencing food insecurity, maybe a more intense level of food insecurity. So Feed the Family Fund provides meal swipes. So where students can go into the dining halls on campus and just have a meal and sit down with their friends and eat on campus just like everybody else, which we think is really great and we're really excited about. I think this is the 3rd year that we have done Feed the Family Fund, and we've had really positive feedback from that program. So we will continue to do that. Applications for that program are open the entire month of February. Students do have to apply, but we don't ask for any sort of formal documentation. We just really want to understand more about what's going on. And so applications are open in February, and then Feed the Family Fund is applied for the next year. So if you applied in February 2021, then you would get Feed the Family Fund meal swipes in fall 2021 and spring 2022. I know that's a very early, but we have to get a lot of information and then talk with financial aid and all of that. There's a lot involved in that. So that's why that process happens so early. So I'm going to kind of skip over this part. I can send these to you, Sarah, if you want to upload them with the recording for everybody, but this is just some kind of basic resources that we work with really closely, just some other offices. And then the last thing I really wanted to go over is just how to contact us. So Catherine is the manager of the Auburn Cares office, and that is her information. And then Carrie, she is the other coordinator for Auburn Cares, and she oversees the medical withdrawal process. So if you have questions specifically about that, she would be the best person to contact. And then Sarah Grace, that's me, and that's all my information. And then the Auburn Cares at auburn.edu is just a good general email to get any of us. And basically whoever is first available will respond to that. If you have any questions that are more personal in nature after this presentation, you're thinking, I feel like maybe I could use this service, or I really want to talk with you about the student in my class, please feel free to reach out to me either by phone or by email. I would hate to have those conversations here with other people around and talk about that. But at this point, I now will open it up to whatever questions y'all do have. I'm happy to answer questions all day long. So whatever you guys have, go for it. And I'll leave this up for a couple more minutes in case anybody wants
it. Hey, this is Brian Barentine. How you doing?
I'm good. How are you, Brian?
I'm doing great. Hey, I'm with the GSC, but I'm also with the SGA Senate, and I was wondering if I might be able to share this slide deck with some of the SGA folks so they can disseminate it further.
Yeah, absolutely. I'd be happy to send this to you, Brian. I will make a note and do that as soon as we're done.
Thank you.
Yeah.
Hey, this is Autumn Busby, and I had a question too.
Yeah, go for it, Autumn.
Hey, so about like if we wanted to have you guys check in on someone,
Mm-hmm.
would it be anonymous that we were the person who asked?
So that's a great question, and it kind of depends. So I don't necessarily have to like call someone and be like, "Hey, Autumn said they're super worried about you." However, if I call and say like someone was really worried about you, it sounds like you've been going through a really hard time, and you're the only person that that student has talked to, then like they may be able to put two and two together and know that it was you, if that makes sense. But I don't necessarily like have to call and say like, "Hey, Autumn said this is what's going on." Does that
Right.
make sense? Does that is that helpful?
Yeah, the situation I'm thinking of is last semester I had a student, I'm a TA,
Mhm. Okay.
and I just it seemed like something wasn't right, and it was
Right.
I didn't want to call them out, or
Yeah.
I didn't know if like in that situation, if using my name would make them feel uncomfortable, like if classes weren't over, or
Gotcha. So I will tell you that I reach out to students a lot and say like, "Hey, your professor or your TA or whoever, seems really concerned about you." Usually I frame it in this like, your professor says that you're like such a great student and things just seem like kind of off and they're super worried and like really just want to make sure you're okay. And usually students are like, that is the nicest thing ever. Like, I can't believe that, out of all these classes and all these people that they're interacting with, that they, want to make sure that like I'm okay. That's really nice. Even if they're like, no, I'm fine. Like, I'm just having a bad week, I got to an argument with my boyfriend or something like that. They still seem to think that this is like really, really kind for people to be worried about them and want to make sure they're okay.
thank you.
Yeah, of course. Anybody else have questions?
Hey, Brian again. Hey, we talked a bit about this current environment that we got with everybody's working remote, and we kind of lost the human touch. Anecdotally, or any statistics that you have you seen picking folks reaching out, or is it less because there's just not that information flowing like you might have people were seeing each other every day?
Yeah. Sorry, you kind of broke up in the middle. Are you asking like just in general about people using Auburn Cares? Are people being referred less, or did you say something about the food pantry?
No, it's
okay. Just okay.
Yeah, it's specifically regarding the the remote environment that we have.
Yeah.
We're
Okay.
in our second semester now, and anecdotally, I've talked to a lot of folks that are saying, "Hey, my performance is declining. I'm not interested in it as much. I'm thinking about taking time off."
Yeah.
Have you seen more folks reaching out or being referred, or just less because they're isolated?
I think we're still probably getting the same amount of referrals. I think they're just for different things than we would usually be getting referrals about. So like typically we would probably be getting a lot more like mental health related referrals, or students who maybe were stopped by a professor going out of class just saying like, "Hey, something seems up, you okay? Like, let's check in." Those moments obviously aren't happening in the Zoom world. But we are getting a lot of like, "Hey, this student has like never logged into my class," or like, "I've tried to email them and can't get a hold of them." So um, we were getting a lot of those, and a lot of students who were really struggling with the online environment and really feeling isolated because of everything being online and not being able to have that human touch like you said. So we definitely saw a similar amount of referrals, just for I would say like a different type of referral.
Maybe at the GSC Senate. I've in my role interacting with a lot of the students at the SGA, mostly undergrad.
Mhm.
The GSC Senate meeting we have next week. Maybe we can kind of poll the graduate students, see what their specific needs are, because I'm sure they're different than a lot of the undergrads.
Right.
Hey, this is Shahariar. I'm serving as the president for this GSC. I
Okay.
have a quick question for you. So when you get the referrals, do you have any idea like how many of them are graduate students and how many of them are undergrads? Like, is there any statistics on that?
Yeah, give me a second and I can probably pull that up for you. Let me see.
I'm just trying to see like each year how many graduate students are using Auburn Cares and whether we can like share the information with all the graduate students, and let's see whether there are more graduate students interested in contacting Auburn Cares in the future.
Yeah. Let's see if we have this. Okay, so it looks like and this is not surprising, our biggest referral group is typically, so this is just for fall, not, and this is compared, like, we usually compare one semester to another because typically like fall is more busy, right, than summer, things like that. So it looks like for fall 2020, we had about 135 freshman students referred, 100 sophomores, 95 juniors, 94 seniors. So sophomores, seniors, and juniors all about the same. Graduate students were only 22. So not a lot of graduate students. In previous years, previous falls, like fall 2019 was 142 freshmen, 123 sophomores, 99 juniors, 100 seniors, and only 23 graduate students. And that's similar for fall 2018 as well.
Well, I think that makes sense compared to the, like, when you compare the actual number of undergrad students in Auburn University versus who are contacting Auburn Cares. I think
that's true. Looking at like percentage rates of how many are undergraduate students. That's a good point.
Yeah. So yeah, that's it. Thank you.
Yeah. Like I said,
one question.
Oh yeah, go ahead, Sarah.
Or just a thought. We had polled graduate students not too long ago, and one issue that was recurring of like just a challenge that's presenting itself now is COVID loneliness. I know you kind of touched on that, and I know that there's not one solution to that. It's a very kind of broad and overarching challenge that is facing graduate students. But do you have just off the top of your head, other than kind of interacting with these resources and putting more of these resources out there, do you have any thoughts on that?
So I will say, like, as a graduate student myself, I think one thing that I have really missed and that has like kind of been hard is just not even seeing like your classmates face to face, and not getting those, my classes are typically like 3 hours, 1 day a week. And so typically our instructors will break up our class about halfway through, give us a little break, let us go get a snack, things like that. And so it was always a really good time to just kind of check in with your classmates and say, like, how is this going for you? How are you doing on this assignment? Like, I'm kind of confused. How are you doing it? And just kind of led to a lot more conversations. So one of my instructors this semester has been putting us in breakout rooms of just like 2 or 3 people at the beginning of class and giving us like 5 to 7 minutes to just kind of like get to know each other and check in with each other and just kind of like see how people's weeks are going. And that has been really, really nice to just have, because right now the only times I'm like Zooming and seeing people are for meetings. So we're talking about, work-related things, and then we're getting off the Zoom call. So I think it's been really great. And if you are teaching or you feel like you have a good relationship with your supervisor and could encourage them to do that, I think that would be really nice. because I think that that is like one of the easiest ways to combat this is to just like give us the ability to connect in small ways, or, you know, maybe message everyone in your class and say like, hey, would you guys want to make like a group meet for this class so that we could, you know, all get in touch with each other. If you're having classes that are like mixed, you know, beyond just your program, I think that that can be really helpful too. So those are just some small things that I will say have been helpful for me. I'm also trying to be more intentional about, you know, setting up a time to like FaceTime family or, you know, call a friend, things like that. Just because when you're used to being out and about and seeing people, you have to be a lot more intentional about your free time and meeting, or not necessarily meeting with people, but like being with people however you can.
Thank you.
Yeah, of course. Like I said, if y'all have other questions that are maybe more personal in nature, or if like an hour from now or 2 days from now you think of something, please feel free to reach out to me. You are not going to bother me. I am always happy to answer questions, even if it is not an Auburn Cares question, but it's like a, hey, I have this thing going on and I don't really know what to do or where to go or who to ask for help. Ask me, I'll help you figure it out. I'm always happy to do that too. So part of my job is literally to know all the resources and all the things. So I'm pretty good at that. So, so yeah, anything I can do to be helpful.